Hello, everybody, and welcome to our presentation today by Bluegrass Nursing. Today, I am joined by a few of our department heads that will be going over a few facts and protocols for the emergence of COVID-19 and the recent positive COVID test that has occurred. As always, if you have any questions or concerns, we are all here for you, so please do not hesitate to ask. With all this being said, please listen to this brief presentation from our Director of Marketing, Yash Patel, who will be going over a few COVID-19 facts.
Hello, everyone. Thank you guys for taking the time to join us today. I'm sure you guys have been aware of the situation that a resident at our facility has tested positive for the COVID-19 virus. And today I am going to be giving you guys an input as into what we should do as a community and a group as to what we can do to neutralize this virus and a possible outbreak within our facility. So we are going to be going over the progressions that we need to take with the vaccine and the actions going forward with that. So first up, I have a graph here for you guys from ABC 36. It outlines the number of people that have been vaccinated and the population within Fayette County. It is currently 63% that we have fully vaccinated within our city, which is a great number, but we need to push and push to make sure that number keeps growing and growing over time. It has been shown across the entire population from all ages that everyone is continuing to get vaccinated and getting tested every day. The number just keeps growing and growing. Our higher risk populations have grown to over 90%. Over 65 years of age and older, our population has had at least one dose, which is 95%, which is an amazing number, and we just hope it continues to grow and possibly get to that 99 to 100% threshold. But it is important that our youth is also being vaccinated, and they are also continuing our push to make sure everyone gets vaccinated, or at least one dose, to push that everyone can be able to have less symptoms than others that are unvaccinated. So here I also have the number of COVID cases as of December 29th of last year. So towards the end of the year, Fayette County has had a rise in COVID cases, and it has been the highest number of cases we have had as a county from the beginning of the virus up until this point. We have reached over 500 cases as of last week, which is an all-time high going back to the peak and prime of COVID back in the early years of 2021 and late of 2020. It is something that we have seen with our new variants. We have now Omicron. We have passed our other variants, but this one has been seen as more transmissible and is something that has shown less side effects, which is also something that is important to take into account. So we need to make sure that everyone is getting vaccinated, push towards that to make sure that we are all reacting to this virus in the most appropriate way. And we have also taken note that over 80% of those that have been hospitalized for the virus as of late have been unvaccinated. And therefore, that proves that the vaccinations are keeping people out of the hospitals for the most part. Although they might contract the virus, they are the ones that are not suffering that as much as others may if they are unvaccinated. So with that being said, we have time for a short Q&A session. Some questions that follow are, what is the biggest challenge that we should be focused on at this point? So the biggest challenge would be to neutralize the virus, make sure that it does not spread to our other employees and residents within the facility, and make sure that we can keep it isolated and prevent any further spread of the virus. I would say is the most important thing and the biggest challenge. Next question would be, what additional resources do you need now to begin making an impact? I would say the most additionally resources that are most important are to have just the mask, hand sanitizer, social distancing, having your vaccine. It's things that we all know that are important that we have to make sure that the virus being spread is not going to happen as much as we need it to happen. So those are the things we need to follow. What time frame should we expect to recover from this crisis? Honestly, I would not put a timetable on this recovery because it's COVID is probably most likely here to stay. It is something that we have to live with at this point, and something that we cannot shy away from at this point in our time. It is something that is going to continue and continue and continue to build up, build different variants, provide different side effects. It's just going to be here to stay. We need to cope with it. We need to build antibodies for it. We need to react to it. We need to take our tests. We need to get our vaccines. We just need to be built and be ready for it. And we will hopefully overcome this virus sometime in the future, but there's no timetable to this virus. So with that being said, that is our Q&A session. Thank you for joining us. Pass it on to our next guest.
Hello, my name is Jake Gardner. I'm the senior accountant here at Bluegrass Nursing, and I'm here today to deliver some important news regarding several changes that are being made here in response to the recent surge in coronavirus cases, as well as one of our own employees testing positive. First of all, I want to talk about how we are planning to handle this as an organization and how we are going to prevent the spread of this virus. We are going to begin to increase access to hand sanitizer and provide disposable face masks throughout all of our facilities. On top of that, we're going to offer free testing for all of our employees and residents. Any employee who happens to test positive will be given a paid 10-day leave to quarantine until their symptoms dissipate. On top of that, we're going to be providing the increased use of disposable gloves whenever possible, increased social distancing, and we are going to be taking extreme increased measures to make sure that all of our equipment and facilities are as clean as possible. From now on, visitors must present a negative COVID-19 test in order to see our residents. I want to mention some important protocols to take outside of the workplace. Obviously, in the workplace, masks and social distancing are required, but there's no point in not using masks and social distancing outside of the workplace, getting the virus and then bringing it inside of the workplace, spreading it to others, just to wear masks and social distance there. That being said, we urge all of our associates to take safety protocols both in and out of the workplace. This includes avoiding large gatherings when unnecessary, testing as frequently as possible, and avoiding contact with anyone who is positive for COVID-19 who has not been tested recently. It's also best to avoid unnecessary contact. For example, it might be best to wave rather than walk up to somebody and give them a high five. Please do not be the person that walks into our facilities with COVID-19 and spreads it to an at-risk resident. I want to encourage you all to wear masks outside of the workplace as well. The data shows that wearing masks prevents both the person wearing it and those around them from contracting the virus. As the infographic on the left shows, when both people wear masks, the possibility of spreading the coronavirus diminishes by 98.5%. It is especially important to wear a mask if you have not been tested for over a week or suspect that you may have been exposed to somebody with COVID-19. I cannot stress enough that masks significantly reduce the risks of COVID spreading, so please wear masks outside of the workplace. On top of that, I want to provide you some data that shows the power of social distancing. With increased social distancing, the number of infections can be exponentially reduced. It may seem obvious, but it's important to remember that the virus cannot spread without contact. We urge our associates to social distance whenever possible and to stay educated on how easily the virus can be transmitted. Without social distancing, the virus can exponentially grow and transmit from person to person. Obviously, in the workplace, we require social distancing as much as possible, but outside of the workplace, if you're not social distancing, the transmission of the virus will spread very easily, and you could be bringing that into the workplace where obviously it's not ideal for it to be spreading to patients who are at risk. That being said, the new variant Omicron is very easily transmissible, and it's especially important to keep social distancing in mind. Thank you all for taking the time.
Hi, thank you everyone for having me as part of this panel today. I'm here to discuss the costs and benefits to the COVID-19 action plan as assembled by our interdepartmental team. The costs are going to be a lot greater than the benefits, but what are going to be the most substantial costs? One of the most substantial non-monetary costs is going to be the time taken away from our administrative staff to deal with the crisis, which will halt progress for Bluegrass Nursing in continuing to move forward and to level up and to get better. It is non-monetary. but it will be a price that the organization pays. The largest monetary cost by far, we believe, will be in the PPE. For example, right now, one N95 mask is retailing at about $2 per mask. This means that it's going to cost the organization about $250 a day just for masks. This doesn't include gowns or face shields or any other type of PPE, gloves being another big example. But unfortunately, due to the price gouging related to COVID-19 and the high need for PPE, we're just going to have to pay this cost as an organization. We're going to incur a substantial additional costs related to incentive pay for our dedicated COVID team. Their hourly rate is going to nearly double as a result of being part of this dedicated COVID team. But we feel like that's going to be necessary incentive to provide the staff to encourage them to do their best in the public for infection control and continue to come in and risk their own health on a daily basis. The administrative team here has also discussed a COVID positive staff benefit plan to encourage any staff member who tests positive to quarantine at home for the 10 days. Now, this is going to cost the organization about $2,000 per person, but we believe that the cost of an outbreak in the facility with all of the residents would be significantly higher. In addition, we think offering this essential plan will provide a morale boost for our staff, that it will help them know that Bluegrass Nursing is behind them, that we want them to do well, we want them to stay healthy. We also expect a capital item purchase for Tavoca, the automated text messaging and calling service. Now, this can also be used in regular everyday course of action business, such as scheduling care plan meetings, coordinating doctor's appointments, et cetera. So the administrative staff is less concerned with this cost. It's about $3,000 setup cost and then $500 monthly thereafter. The PPE cost and the additional incentive bonus payroll costs are going to be the bulk of additional expenses. So with all of this additional expense comes the question, can we find any way to find additional funding streams? And yes, there are opportunities for additional funding streams. Our accounting team has already looked into the federal grant programs and or loans that could be converted into grants in the future, starting with the Paycheck Protection Program, moving into the HHS phases 1 through 4 funding, the American Rescue Plan Act funding, infection control funding. And in addition, they're monitoring HHS websites and leading age, and anything else that they can monitor for grant websites to try to find additional sources of revenue to help mitigate the high expense associated with this COVID-19 action plan. So what's the benefit? The benefit may seem small. It is not small by any means. It's huge. The benefit is supporting the Bluegrass Nursing mission and vision by protecting our residents and our staff. And that is absolutely huge. Together, we are Bluegrass Strong. And with that, I would like to pass it along to our CEO.
Thank you, Jake, Amanda, and Yash for those wonderful presentations and useful information about COVID-19 precautions and protocols. I wanted to wrap this presentation up by reiterating some facts and some useful information and places and resources that you can go whenever you need help as needed. So to share my screen here and then, okay. So I wanted to thank everyone personally from the bottom of my heart for listening to this presentation today. Without the sacrifice and dedication that each and every one of you give today, Bluegrass Nursing would not be what it is today. With your continued patience and cooperation, we will get through these trying times. I wanted to wrap things up by addressing questions and concerns. If you, again, have any questions or concerns, please visit our website here at bluegrassnursing.org/COVID for frequently asked questions and frequently updated information. Contact can also be made through our virtual chat option during hours of operation or by phone number at 859-888-8888. Again, please use this information as needed, as this information will help defeat the virus at its source. Again, the virus will not go away, but if we become closer together and act together, we will be able to defeat this virus at its source, and we will be able to resume normal operations as usual as quickly and promptly as possible. Again, please continue to stay safe. And as always, we are Bluegrass Strong, and we will get through this.